Professor Benedetti, you just held a lecture on how placebos, words and drugs share the common mechanisms of action. What does this imply, and in what way is this relevant to treatment of patients?
Well, as far as we know today, placebos, which means the psychosocial context around the patient, around the treatment, words by health professionals, use the very same mechanism used by drugs we give in routine medical practice. So this means that there is an interference between the psychological component of the therapy and the pharmacological component of the therapy. So this interference could be really very important to develop new drugs, to develop new treatment, not only in the field of psychiatry, but in the field of many other medical conditions and therapeutic interventions.
Could you tell us a little bit more on the placebo response model?
The placebo response is a very good model to understand how our brain works. I am a basic neuroscientist, a clinical neuroscientist, so the main question is to understand why when you give a placebo, which means you manipulate the psychosocial context, there is a change in the patient's brain. So we use the placebo response as a model to understand how our brain works. And this means that when you give positive verbal suggestions, you induce a positive expectation. And this is a very interesting model to understand the psychological components of the therapy. Over the past few years, we have learned a lot that different biochemical pathways are activated by both placebos and drugs.
How do you expect the field of psychiatry to integrate this model more over the coming years? And are there other changes and revolutions in treatment to be expected soon?
The placebo response is very important in psychiatry. The main problem is that it is really very difficult to understand the mechanism because psychiatry, different psychiatric disorders like schizophrenia, like depression, like anxiety, like panic attacks, are very difficult to study from a neurobiological perspective. It is very important. I think it's really very important to develop new models of the placebo response in psychiatry because this will help us to understand what happens in the clinical trial setting and in the medical practice as well.
What do you hope to take away from this year's Congress? Are there any main areas that you are interested in yourself?
The main take-home message for me is that different neuropsychiatric disorders, from depression to anxiety, from schizophrenia to panic attacks, are very important models to understand how our brain works. I would say that most of the treatments we have today for psychiatric disorders are ineffective, or at the best we don't know exactly how they work because we don't know how our brain works. So for psychiatry, I think that the field of neuroscience is very important, and the interaction between neuroscientists and psychiatry is really very important, not only for the disease, the neuropsychiatric disease, the neuropsychiatric disorder itself, but for general functioning of the brain.
Okay, Professor Benedetti, thank you very much for your time.
You're welcome.